A 58-year-old man walked into my office last month, closed the door carefully, and asked me a question he'd been carrying for years. "Doc, I've been doing this every day since I was a teenager, and now that I'm older, I'm terrified. Am I damaging my prostate? Am I making things worse? Should I stop?" He looked genuinely worried, like he'd been confessing a crime, and what I told him changed everything he thought he knew about prostate health. Today, I'm going to answer the question most men are too embarrassed to ask. What actually happens to your prostate when you masturbate every single day? Is it helping? Is it harming? What changes are occurring inside that walnut-sized gland? The answer is going to surprise you, because what the research shows is the opposite of what most men believe. I'm Dr. Jocelyn, a urologist with 15 years of clinical experience specializing in men's health and prostate wellness. And what I'm about to share with you is backed by some of the largest, most comprehensive studies ever conducted on male sexual health. By the end of this video, you'll know exactly what's happening inside your prostate, whether your habits are protective or problematic, and how to optimize your approach for maximum benefit. Before we continue, drop a comment and tell me, are you over 50? Because the answer to today's question changes dramatically based on your age. And don't forget to subscribe so you don't miss the next video where I'll be breaking down the medications that secretly shrink testosterone. Now let me show you what's really happening inside your body. What your prostate actually does. Before we talk about daily habits, you need to understand what your prostate is and why it matters so much. Your prostate is a small gland, about the size of a walnut, located just below your bladder and in front of your rectum. It surrounds the urethra, the tube that carries urine and semen out of your body. Your prostate produces fluid that mixes with sperm to create semen. This fluid protects sperm, helps them move, and provides nutrients. During ejaculation, the muscles of your prostate contract forcefully to push that fluid through your urethra and out of your body. Here's what most men don't realize. As you age, your prostate naturally enlarges. By age 60, about half of all men have an enlarged prostate. By 85, that number reaches 90%. This enlargement can cause urinary problems, discomfort, and reduced quality of life. Prostate cancer is also incredibly common. Excluding skin cancer, it's the most common cancer in men. About 1 in 8 men will be diagnosed with prostate cancer in their lifetime. So when we talk about what happens to your prostate with daily ejaculation, we're talking about changes to a gland that's already undergoing constant transformation as you age. And that's where the research gets fascinating. The Harvard study that changed everything. Let me tell you about a landmark study that followed nearly 32,000 men for 18 years. This wasn't a small trial. This was one of the most comprehensive investigations into male sexual health ever conducted. And what they found was stunning. Men who ejaculated more than 21 times per month reduced their prostate cancer risk by about 20% compared to men who ejaculated only 4 to 7 times monthly. Let me put that in perspective. 21 times a month is roughly 5 times per week. If you're masturbating daily, you're at 7 times per week, which puts you squarely in the protective range. Another study from Australia found that men who averaged 4.6 to 7 ejaculations per week were 36% less likely to be diagnosed with prostate cancer before age 70 than men who ejaculated less than 2.3 times weekly. 36%. That's massive. So what's happening biologically? Think of your prostate like a drain. It constantly produces fluid. And when that fluid sits stagnant for long periods, harmful substances can build up. Toxins, inflammatory compounds, cellular debris. Over time, this buildup can lead to inflammation, cellular damage, and potentially cancer development. Daily ejaculation keeps that drain flushed. It prevents buildup. It reduces the time harmful substances spend in contact with your prostate tissue. I had a patient, Vincent, 62, with a strong family history of prostate cancer. His father died from it. His uncle had it. He was terrified he'd be next. After reviewing this research together, he committed to regular ejaculation, approximately 5 to 7 times weekly. 5 years later, his PSA levels remain excellent. His prostate exams show no concerning changes. And he tells me, "Doc, I stopped feeling guilty and started feeling proactive." Daily ejaculation creates a protective flushing effect that science has proven reduces cancer risk. But here's where age changes everything. Now, before you assume this applies to everyone, let me tell you something critical. The effects of daily masturbation aren't the same at all ages. Research shows that frequent ejaculation in young men, particularly those in their 20s and 30s, may be associated with slightly higher prostate cancer risk. But for men in their 50s and beyond, it lowers prostate cancer risk significantly. Why the difference? Researchers suggest that young men genetically predisposed to hormone-sensitive prostate cancer may be at higher risk if their bodies naturally produce extremely high levels of androgens, the hormones that drive sex drive. In younger men, very high ejaculation frequency might reflect extremely high androgen levels, which could potentially accelerate any existing predisposition to cancer. But for men over 50, the protective effect dominates. The research shows the strongest protective effects at ages 40 to 49, with even more pronounced benefits in older age groups. If you're over 50 and masturbating daily, the research strongly suggests you're doing something beneficial for your prostate health, not harmful. I worked with a patient, Dennis, 56, who was convinced his daily habit was excessive and dangerous. He was filled with shame. He thought he was damaging himself. After reviewing the age-specific research together, he understood that at his age, this frequency was actually protective. His anxiety disappeared, and it was replaced with confidence that he was actively maintaining his prostate health. Age matters, profoundly. The physical changes happening inside your prostate. So what's physically changing inside your prostate when you ejaculate daily? Change number 1, reduced fluid accumulation. Your prostate constantly produces fluid. Daily ejaculation means that fluid is regularly expelled rather than accumulating. This reduces pressure inside the gland, decreases inflammation, and prevents the buildup of potentially harmful substances. Change number 2, improved blood flow. The sexual arousal and ejaculation process increases blood circulation to your pelvic region, including your prostate. Better circulation means better oxygen delivery, better nutrient supply, and more efficient removal of waste products. This keeps prostate tissue healthier. Change number 3, reduced inflammation markers. Studies suggest that regular ejaculation may help reduce inflammatory markers in prostate tissue. Chronic inflammation is linked to both benign prostate enlargement and prostate cancer development. By reducing inflammation, daily ejaculation may slow both processes. Change number 4, maintained muscle tone. The muscles surrounding and within your prostate contract rhythmically during ejaculation. Daily contraction maintains muscle tone and function, similar to how regular exercise maintains muscle health throughout your body. I had a patient, Gerald, 67, who'd been experiencing mild prostatitis symptoms, pelvic discomfort, urinary urgency. He was miserable. After increasing his ejaculation frequency to approximately daily, his symptoms improved significantly over 6 weeks. The regular flushing and improved circulation helped reduce the inflammation causing his discomfort. These physical changes are happening inside your prostate every single time you ejaculate. The critical mistakes that turn this healthy practice into harm. Now, while daily masturbation can be beneficial, there are critical mistakes that can turn this healthy practice into something harmful. Mistake number 1, inadequate lubrication. Daily masturbation without proper lubricant causes friction damage to penile skin over time. This creates micro tears, scarring, and reduced sensitivity. Always use water-based or silicone-based lubricant, especially if you're doing this daily. Mistake number 2, excessive grip pressure. Some men compensate for reduced sensitivity by gripping harder. This damages tissue and creates a negative feedback loop where you need even more pressure to feel anything. Use a lighter touch. Focus on varied stimulation rather than intense pressure. Mistake number 3, rushing the process. Quick, mechanical masturbation doesn't provide the full prostate benefits. The arousal phase increases blood flow. The build-up phase prepares the prostate for complete emptying. Rushing through it reduces these benefits. Take your time. Mistake number 4, ignoring pain or discomfort. If daily masturbation causes pain, burning during urination, blood and semen, or difficulty urinating, stop immediately and see a urologist. These symptoms can indicate prostatitis, urethral irritation, or other conditions requiring treatment. Mistake number 5, excessive pornography dependence. If you require increasingly extreme pornography to achieve arousal, that's a neurological issue affecting your brain's dopamine system. This can interfere with real intimacy and create compulsive behaviors that damage relationships. I treated a patient, Marcus, 61, who developed severe penile skin irritation from daily masturbation without lubricant. He thought the roughness was toughening his skin. In reality, he was causing progressive damage. After switching to proper lubrication and gentler technique, his tissue healed completely within 3 weeks. Daily masturbation is only beneficial when done correctly. The mental health connection you're ignoring. The changes aren't just physical. Daily masturbation also affects your mental health and stress levels, which indirectly impacts your prostate. Ejaculation triggers the release of dopamine, the pleasure hormone, along with oxytocin and endorphins. These neurochemicals reduce stress, improve mood, and promote relaxation. Chronic stress elevates cortisol, which has been linked to increased inflammation throughout the body, including in the prostate. By providing daily stress relief through masturbation, you're indirectly protecting your prostate from stress-induced inflammation. Daily masturbation also improves sleep quality for many men. The relaxation response following orgasm naturally prepares your body for sleep. Better sleep supports overall health, including immune function and tissue repair. I had a patient, Leonard, 64, dealing with high-stress work and chronic anxiety. He started using daily masturbation as part of his bedtime routine. Within 2 weeks, he reported significantly improved sleep, reduced anxiety, and better overall mood. His stress-related prostate symptoms also decreased noticeably. Your mental health and prostate health are more connected than most men realize. The complete framework for beneficial daily practice. Let me give you the complete framework for beneficial daily masturbation after 50. Frequency. Once daily is ideal for most men over 50. This provides consistent prostate flushing without overdoing it. Some men naturally prefer 5 to 6 times weekly, and that's equally beneficial. Technique. Always use adequate lubrication. This is non-negotiable for daily frequency. Protect your tissue from friction damage. Duration. Allow 10 to 20 minutes from start to finish. Don't rush. The arousal phase provides important blood flow benefits. The relaxation phase provides stress relief. Variety. Vary your stimulation patterns. Don't rely on the same mechanical approach every time. Variety keeps your nervous system responsive and prevents desensitization. Mindfulness. Be present during the experience. This isn't just about reaching orgasm quickly. It's about the full experience. Arousal, pleasure, release, and relaxation. Balance. Maintain partnered intimacy if you're in a relationship. Daily masturbation should complement, not replace, connection with your partner. Awareness. Pay attention to your body's signals. If you experience any pain, discomfort, or functional changes, adjust your frequency or technique accordingly. Follow this framework and you're optimizing the benefits while minimizing any potential issues. When daily becomes problematic. While daily masturbation is generally beneficial for men over 50, there are situations where it becomes problematic. If it interferes with daily responsibilities, missing work, neglecting relationships, or avoiding social activities to masturbate indicates compulsive behavior requiring professional help. If you feel unable to stop despite wanting to, loss of control over sexual behavior is classified as compulsive sexual behavior disorder and requires therapy. If it's causing physical problems, persistent pain, skin damage, or urinary symptoms mean you need to stop and see a urologist. If it's completely replacing partnered intimacy, consistently choosing masturbation over sex with your partner indicates relationship issues worth addressing. The vast majority of men fall nowhere near these categories, but if any apply to you, seek appropriate help without shame or embarrassment. Bringing it all together. Let me bring this all together for you. For men over 50, daily masturbation creates several beneficial changes in your prostate. It flushes out potentially harmful substances. It reduces cancer risk by up to 36%. It improves blood circulation. It reduces inflammation. It maintains muscle tone. And it supports overall prostate health. The research is clear and compelling. Men who ejaculate at least 21 times a month have significantly lower prostate cancer risk. The key is doing it correctly. Use proper lubrication. Take adequate time. Avoid excessive pressure. Pay attention to your body's signals. Your prostate is constantly changing as you age. Daily ejaculation helps guide those changes in a healthy direction. The man who walked into my office terrified that his daily habit was destroying his prostate, he left with a completely different understanding. He wasn't damaging himself, he was protecting himself. And that shift from shame to empowerment changed everything. If this information helped you understand what's happening inside your prostate, leave a comment below. Tell me, did this change your perspective? What surprised you most? And share this with another man who needs to hear it, because this information could literally save a life. I'm Dr. Jocelyn. Your prostate health matters, and you deserve accurate information to make informed decisions. Take care of yourself. See you in the next one.